Health organizations are sounding the alarm over what they say is the country's worst blood shortage in over a decade. The American Red Cross is declaring it, quote, a national blood crisis, and released a statement along with other organizations saying, quote, in recent weeks, blood centers across the country have reported less than a one-day supply of blood of certain critical blood types, a dangerously low level. If the nation's blood supply does not stabilize soon, life-saving blood may not be available for some patients when it is needed. And joining us now to discuss the blood shortage are Selena Roldan, CEO of the American Red Cross in Illinois, and Dr. Thomas Orazak, Chief Medical Officer and Executive Vice President at Northwest Community Healthcare. Welcome both of you to Chicago tonight. Selena Roldan, explain why things are so bad right now.
So at this time of the year, during the winter months, we typically always see a blood shortage, and that is because of inclement weather, flu, other illnesses, colleges and universities that are going on break. But this most recent COVID surge is exacerbating those challenges where individuals that have and currently have had blood donation appointments are canceling because they themselves are testing positive or they have been exposed, creating our current blood shortage.
And Dr. Orazak, from your vantage, how is that impacting hospitals and their ability to complete critical care services?
Yeah, thanks. So there's a couple groups that we worry about who require access to blood frequently. First and foremost is patients who are being scheduled to come in for surgery that is invasive or we know is going to require some form of blood products or blood transfusions. This would include things like open heart surgery or certain types of vascular surgery. In these cases, we actually prepare blood to be made available ahead of time in the preoperative phase. Additionally, patients who are suffering from certain blood cancers like leukemias or lymphomas typically require transfusions on a regular basis, and that's because that illness prevents their body from producing the normal red blood cells and platelets and other blood components that a healthy human is normally able to produce. So they very frequently need support on a regular interval. Additionally, patients who are receiving certain types of chemotherapy specific for treatment for types of cancer very commonly require transfusions during the period in which they're receiving the chemotherapy. And that's simply an effect of the chemotherapy as a side effect of what it's doing to the body as it's helping fight off the cancer. So
these are all things, doctor, that blood is necessary for. And Selena Roldan, put this in perspective here. How much supply is available right now versus what is typically needed?
The American Red Cross has seen a decline in over 10% since the pandemic began, and we typically have a 5-day supply on hand, and we right now we're seeing less than a 1-day supply. So it really is creating challenges for doctors and hospitals who are having to make really difficult decisions about, who receives life-saving blood. Once every 2 seconds, someone in our country needs blood. Blood also cannot be stockpiled. And it's important to know that blood has a shelf life of 42 days and can only be replenished by our generous blood donors.
And Dr. Orazak, are you seeing that at your hospital where you might have to delay certain procedures or make choices based on the blood supply that's available?
No, we have not had that up to this point. We've been able to make do with the supplies available. I think this is more pressing issues for hospitals, specifically those that are trauma centers, where they need this type of blood, the universal donor blood, to be able to provide at a moment's notice for somebody who may come in with significant internal bleeding.
And Selena Roldan, for the folks right now that wonder, well, if I've had COVID-19 or if I have the vaccination, is it safe for me to give blood? Your message to them is what?
Yes, it is safe to donate blood. Blood donation is an essential service. It's critical to maintaining healthy communities and avoiding a future public health crisis to ensure that we have blood supply in hand. Blood drives are some of the most regulated environments. And of course, for the American Red Cross, the safety of our donors is our top priority. And so we are encouraging individuals, if you have recovered from COVID-19 and you are 14 days past any symptoms, it is safe for you to donate. It is also important for people to know that there has been no case of a transmission of a respiratory illness, such as COVID-19, through blood donation.
Dr. Orazak, how extraordinary is it that you're seeing the Red Cross and other organizations call this a crisis right now? Does that speak to the gravity of the situation?
I think it absolutely does. This is unprecedented. We've not heard language like this before from the Red Cross. And I think, like Selena was mentioning, it's a confluence of many different factors that really led us to this point.
And Selena Roldan, there's also been an issue, some confusion around gay men and their ability to donate blood. The federal government loosened some restrictions in 2020. What is that status right now?
Yes, the American Red Cross and all blood organizations are regulated by the FDA. And in April of in 2020, the FDA did reduce the restrictions on men who have sex with other men, MSN, from 1 year to 3 months. And the American Red Cross was very happy to hear and see this announcement, as we believe that sexual orientation should not be a determinant in blood donation as we work toward a more inclusive blood supply.
Dr. Orszag, break this down for us. Does this shortage affect any particular blood type? Are there blood types that hospitals like yours need more right now?
I think what's most critical is the type O blood, which is the universal donor blood. As I was referencing, this is what's used when you don't have time to cross-match a patient. So for instance, somebody comes into the emergency room after suffering a trauma, you need to give them blood immediately. This is the blood we utilize for those situations.
Selena Roldan, are you seeing any kind of uptick right now, and what else needs to be done to get that supply up?
We are, again, incredibly optimistic and very grateful for all of the individuals that have rolled up a sleeve to help us save lives. We are encouraging individuals, if you don't find an appointment tomorrow, continue to go to redcrossorg.blood.org to find an appointment in the days and the weeks and months to come, because this is not a sprint, it is a marathon, and we know that this blood crisis is going to continue.
All right, very important topic, and our thanks to Selena Roldan and Dr. Thomas Orszag. Thank you so much.